Melissa, thank you so much. And she has been the face of basically Toronto's COVID-19 task force here, looking at everything, providing those daily updates. We're talking everything from vaccines, the new variant, the rising case counts. There is a lot of COVID-19 news that we need to keep track of and to tackle. Joining me now, Dr. Eileen Davila, Toronto's Chief Medical Officer of Health, for our year-end interview, and there is a lot to discuss. Good morning, Dr. Davila.
Good morning.
First, I do want to say, and I expressed this to Mayor Tory as well when he joined us for his year-end interview, it has been a lot, and I know it's been a lot for you personally as well, personally and professionally, so we do appreciate you taking the time for us and for the public to provide updates. I know it's not an easy task, so thank you for that.
Well, thank you.
I want to begin here, Dr. Davila. Let's get with the latest numbers. December 24th to the 27th, looking at over 2,200 new cases, looking at 64 new deaths. I know for a lot of people, they see these numbers now, and some people start to glaze over. And we shouldn't glaze over because these are lives. So let's talk about why these numbers specifically are significant. And, you know, we're going to look at a bigger tally as well as the holiday wraps up.
That's right. And, you know, well, I think you raise a really important point. It is easy to glaze over when you hear large numbers, and we continue to hear large numbers day over day. But we do have to remind ourselves that each and every one of those numbers is not just a number. It's somebody's friend or mother or father or brother or sister or their colleague. These are people who are part of our community. And we can't forget that. That really does have to stay top of mind. I think the other thing that's really important to note is that when we're talking about cases that we're reporting today, we're talking about infections that were acquired as long as 2 weeks ago. So these numbers will continue to increase, and we'll continue to see relatively large numbers, especially if people do continue to interact with people outside of their household, people with whom they don't live on a regular basis. This is what gives rise to ongoing COVID-19. And the final point that I think we should make is that a certain proportion of these cases, not all of them, but a certain proportion of those cases will end up developing serious illness, requiring hospitalization, and unfortunately, as we've seen in the numbers, may also lead to death as well. And so that's why it's so important for people to continue to stay vigilant about those self-protection measures, watching distance, wearing your mask, washing your hands as much as possible. As difficult as I know it is at this time of year, these are the best things that each and every one of us can do to help reduce the spread of COVID-19 and to give vaccines the best chance that they have for us.
Doctor, do you assume there's going to be an uptick in numbers considering the holidays are still continuing, but are you anticipating that?
Well, you know, I think we have to be, sort of forward looking. And I think that we would be wise to anticipate that. How big it's going to be, we don't really know. But I do think that from what I've seen from the chatter that's out there, I mean, people are posting things on social media. We do note that there were a number of gatherings that were going clearly against advice. But I would say this, we also know that a lot of people, right? A lot of people all over the city and indeed all over the province have also gone out of their way to follow the advice, to really be very, very mindful around protecting themselves and those around them so that we can have a brighter 2021, which I know we all so desperately want.
We all desperately want, we all desperately need. Do you have access, while we're talking about numbers, to any of the newer figures for today yet, or is that this afternoon?
So we should have some new numbers coming for you this afternoon, and we will continue to provide those numbers, you know, as we have throughout the year as they become available. But again, I think it's really important that those numbers are in our hands. What we do actually determines where those numbers go. But we have to be also mindful that it takes a couple of weeks before you really start to see the full effects of what's happening today.
Indeed. Let's talk a little bit about this year. Well, let's talk a lot about this year. It has been An interesting one. I remember talking to you really earlier on in 2020 when we were just hearing about COVID-19. Before we were even calling it COVID-19, we were saying coronavirus. What is this that we are seeing overseas? And I remember in this conversation we had said, listen, Toronto is ready for this because we've been through SARS. We've had a lot of lessons learned. Do you still feel the same way? Is there anything that you think we could have done better in preparation of?
Well, Mel, I would say this. You're not a good professional if you don't evaluate what it is that you do, and if you don't honestly say that, look, are there things we could have done better? Yes, there are always things that we can do better. And there were a number of lessons learned from SARS that were applied, and some lessons from SARS, because SARS is a different virus, that actually don't make sense for COVID-19. And so each virus has to be taken in and of itself and understood as its own disease entity, because each situation is slightly different. SARS was a very different circumstance. It was basically localized to healthcare settings. COVID-19 transmitted very readily with or without symptoms. And in fact, we saw it all over the world. And what I think is interesting is that the challenges that we had were also seen in many places all over the world. So I think we were all learning our way through them, learning through the different aspects of this virus, learning our way through the challenges. And I think that the people of Toronto can rest assured that those of us at Toronto Public Health, we did the very, very best we could as we learned through the situation, right? New virus, you don't know all the answers until you actually start to have some experience.
Now that we have some experience with this, we are, let's say about a year in, what is the biggest lesson that you've learned about this virus or about the handling of it? Maybe it was within the communication with the public.
Yeah, I think there's so many things that, if I started to go through all the lessons learned with COVID-19, and I know that there will certainly be time for that, even as we move forward, even with vaccines, I suspect that there will be lessons learned. I think what's interesting about this particular virus is managing through something where it could be transmitted either with very, very mild symptoms or without symptoms whatsoever. And that makes for a very different kind of public health measures that need to be taken. For most infectious diseases, you don't really spread that much, or you spread more when you're actively, with symptoms, coughing or with fever and what have you. And we found in this particular case, you could have very significant transmission and spread from people who really had very mild symptoms or no symptoms whatsoever. So that calls for a very different kind of approach. And frankly, it's one that's very, very challenging. How do you manage, when people who don't even know that they're sick are actually spreading disease?
Absolutely
unbeknownst
difficult
to them.
Yeah, right? I mean, obviously, the masking policy that has helped to a degree, and most people are abiding by it. How long do you think we are going to be in this reality? Obviously, we have the vaccine, but there is a slower rollout here. But to keep that distance, to wear these masks, do you think it could be years that we're in this scenario?
I don't think any of us really knows what the full answer is. There's been a lot of conversation in the scientific community around, so how much coverage do we need with vaccine in order to be able to relax some of the measures that we've had to adopt over the last year? And nobody really knows the answer yet. These are, safe but new vaccines. So our experience is very much developing. So I think in the same way that we experienced in 2020, that we have to learn as we go, observe as much as possible. Again, a very, very professional practice to take the best course of action based on the information that you have at the time, observe, and then change course as need be. I think that's going to be the kind of activity that we're going to need to adopt through 2021 until such time as we have more answers by way of what does it look like with vaccine? Right. What is our experience? And how does disease, how do disease patterns change as vaccine becomes more deployed out there and is taken up by more and more people?
I want to get your take because we've already talked a lot about what's happening now, but we want to look ahead. But that being said, yes, we want to look to the positive, but this UK variant, There's a lot of concern, a lot of chatter about could we discover more of this here, and we haven't seen it yet in Toronto, but are you anticipating that we will see it?
You know, I think just given the nature of this disease and given how much movement there is from place to place still throughout the world, I expect that we should see that at some point here in the not too distant future in Toronto. But I think the really important part with this UK variant, lots of questions still not fully understood as to, is it truly more transmissible? That's certainly the suggestion, but there's lots of study that needs to go on to confirm that. But the really important part here is that it just reminds us how very important it is to keep those self-protection measures up. Do not let your guard down. The best protection still for now against the UK variant or any strain of COVID-19 is to keep your distance as much as possible, especially from those with whom you don't live, to wear your mask when you're out and about, and to wash your hands as much as possible. So these core behaviors, the ones you've heard me speak about for so many months now, continue to be the mainstay.
Okay. Dr. Davila, we appreciate your time. I know this has been a hard year for a lot of people. So thank you for all the work that you continue to do. We appreciate it. And let's look forward to a positive 2021. Thank you.
Thank you.
All right, 2021, guys, let's look forward. Let's shake it off a little bit. Let's see if we can find some laughter. Nicole and Frank, please give us something to smile about. Please say yes.